In this week's episode, we continue to showcase the wonderful work that's been done by the Eskom Foundation. Eskom has shown its commitment to skills development as well as job creation to advance the development of South Africa. Today we look at the Foundation's mobile clinics, and these are aimed at assisting rural communities that cannot have access to proper medical facilities. I'm Tim Modise, and welcome to another episode of Eskom's Journey. But before we go into today's issue, I'd like us to take a look back at the organization's history. It has become clear that many of Eskom's power stations are situated in Mpumalanga, as we once again revisit the province to learn about Kendal Power Station. Kendal Power Station is approximately 40 kilometers southwest of Witbank in Mpumalanga, and it employs about 850 people. It is the largest indirect dry-cooled power station in the world. Kendal's construction started in July 1982 and was completed in 1993. The first unit went online in 1988. This power station is designed to generate approximately 4,000 megawatts. Because Kendal has an indirect dry cooling system, it uses significantly less water in its cooling processes than the conventional wet-cooled power stations. The station's cooling towers are the largest structures of their kind in the world, with a height and base diameter of 165 meters. Like Camden, Kendal Power Station is coal-fired as it sits in a coal mining area. It is the 22nd largest coal-fired power station in the world and the largest power station of any kind in Africa. As part of its national health program, the Foundation approved 4 health buses to provide medical care to rural children who otherwise would not have access to it. In today's episode, we'll try and understand how many people benefit from this initiative. And the champion is Brenda Kruger. She'll provide us with more details.
This project, that we call Bopelong Health Mobiles, is one of our national programs. The project was started in 2012, the initial program. We started operating in March 2014 in Mpumalanga, and then we rolled out to the other 3 provinces. We decided that we need a health solution that we have to take to communities where Eskom operate, but it had to be a mobile service so that we can make this available for communities that cannot afford to take their children to hospital and clinics. The thinking for us was to specifically target primary schools because we look at preventative primary health care. Our idea is rather to prevent conditions, extreme or serious conditions, at primary school level than try to fix them when the children are older and in secondary school. The Department of Health, they identify the schools through the integrated schools program, health program. They draw up the schedules for us, and then we visit the schools as identified by them. We look at testing of eyes for the children. We look at their general health conditions. We also do dental screenings, extractions, fillings for children. So we're definitely trying to help out there where we know, especially in the poorer communities, where the parents cannot afford to take their kids to hospital. To date, we've basically touched the lives and screened over 29,000 children, over 326 locations, and we've also prescribed 660 spectacles for children that have got eye conditions that they didn't know about before. It makes me feel great. It's my contribution, and I think Eskom's contribution, and Mobile Satellite Technologies contribution, and the Department of Health's contribution, because we're all partners in this together. It makes us feel very good to know that we can really make a difference out there, especially in the lives of smaller children. For us to do preventative health care rather than trying to band-aid when the children are older, we can pick up these conditions now and we can try to fix them. We had special cases where there were children that was sexually abused, also children with conditions like elephantitis, severe skin conditions, and those are things that we actually took those children to specialists. We got the Department of Social Development involved. So we're really trying to make a difference while the kids are still young, while we can still make a positive impact in their lives. It's very important that parents are very close to their children's development. If there's anything that they suspect that is wrong with their kids, report it to the educators in the classrooms. We also look at identified kids. So if there's a child with a certain problem and that child is identified by the parent and they inform the Department of Education, once we get to the school, we will also look at those children. If it's something that we cannot help the kid with, we will refer them to either specialists or a hospital, and the Department of Health will help us follow up, and the Department of Education. So there's no case that we will leave unattended to. We will make sure that we follow them all up. The parents must be really aware that they should report all of those things to the schools, to the principal, and it's all confidential information. But we will make sure we will pick that up on the mobiles, and we will definitely take it further. Currently we operate in 4 provinces, in Mpumalanga, Limpopo, Free State, KwaZulu-Natal. Our partners are Department of Health. We cannot do this project without them. Also, obviously, the Department of Education. They also assist us. And then we're also in partnership with Transnet, where the buses collaborate with their Telepepa trains. For 6 months of the year, we visit schools in the communities they operate. They will park at the stations, we will visit the schools, they will service the community. And we started that collaboration now in 2016. We're also going to partner with other institutions like the University of KZN. They want to put some student dentists on the mobile. We also want to bring mental health onto the mobiles, where we go out to schools and they train the teachers to look at identifying children with autism. So the project is getting real big at the moment. Our partners are growing every year. We have other organizations interested in being part of that. A number of positive things came out of this project. As I said, we've identified special cases. We've also identified children with problems. It could be just an eye care problem, a child that can't see properly. It's not that there's anything else wrong with them. Those children will be better off in school. There are many things that we identify that parents didn't know was a problem, or the Department of Health, just due to budgetary constraints, couldn't take further, that we as Eskom and Mobile Satellite Technologies decided we're going to do it from our own pockets and help these children. Our plans is to expand. We would ideally love to have a mobile in each province. For next year we're planning to expand to the Northern Cape, and we'll see after that whether we can at least have a mobile in each province of the country. I feel very proud. I feel very proud. It's one of those things that you get the opportunity to help and assist and bring your part. So it's extremely important for me, and I just love the work I'm doing in the whole corporate social investment fraternity.
The whole process of the mobile project starts where the actual operator will go to the school and collect 10 kids at a time. We do not obviously want to interrupt the schooling day, and that's why we stick to numbers of 10. The operator will then register them. Each of them have their own forms. A unique file per child is obviously then created. They will then start the traffic flow within the mobile. We have a little waiting area here, obviously, so that we don't jam-pack the place and there's no bottlenecks. We then move into optometry. Optometry, we've got a autorefractor. The autorefractor will do a prescription reading within 45 seconds, and that gives the optometrist a starting point. Besides for just refraction, the optometrist does the health of the eye as well, and he does different tests such as your stereo to get an idea of depth perception as well as your color vision. In the event that a learner does need spectacles, we've got a collection frame here, and the order is then sent through to our offices on the computers, and we get the orders and prescriptions in Johannesburg, and that starts the whole process of having it go through our labs and getting it ready for when the operator or the optometrist rather comes back to the school and does the dispensing. The learner, once done in optometry, will then move to primary healthcare. Within our primary healthcare section, the learner obviously then gets a full general health check from head to toe. The nurse that's obviously within the PHC station will take vitals. She'll also do checking of ears with the audiometer, and the audiometer will then give you different decibels as to which sound the child should be hearing. And we do vitals by means of checking like blood pressure and that sort of thing. We also do consumables that we provide to the learner by means of over-the-counter medication that obviously gets given to the teacher, and the teacher will then inform parents on how to give the learner their medication. But medications such as calamine lotion, Panado syrup, multivitamin syrup, that sort of thing we provide on the mobiles as well. Once the learner is done in primary healthcare, then we move on to dentistry. Here the learner will get pretty much the same services you would in a brick and mortar. The mobile itself is catered to have the autoclave, which does the sterilization. We've got all the hand pieces to do fissure sealants, fillings, restoration work, suction. Literally, like I mentioned, everything that you can facilitate in a brick and mortar dental room, we can facilitate in the mobile clinic as well.
I'm an oral hygienist. So oral hygienist, you know, like on a preventative side mostly, teaching the learners or the kids how to take care of their mouth or the teeth, because the mouth, it's not about the teeth only, it's quite a lot of structures in the mouth. We do fissure sealants. If the tooth is rotten or decayed, we do fillings, and then there's a dentist on board as well. We do extractions. You could see that sometimes they come in and they are scared, you know, even to go into the bus, to sit on the dental chair, they are shaking and all that. But once you start explaining that, you know, you're gonna get help, and then afterwards, the smile, the hug, you know, when the little kids hug you and all smiles, and even with the tears, but now there is a smile afterwards. It's really good, you know, it's a good feeling. For me, I would really love to see a lot of these buses going to more places like this. It will be too good for the country. Like, we will have a healthy nation afterwards.
It's nice working with kids because I love kids. So this is like, it's what I really enjoy doing this. Well, the challenges I didn't have, maybe sometimes go fihlela mo di area tse leng gore like tsela tsa gona di mpe wa bona bus ga e khone go tsamaya right, but ga di ngata bya di enjoy ya go thusha bana ba, because a ke rena re prevent malwetse ge ke dira di immunizations, ke dira ke treata tsona di minor ailments ke gona go thibela gore bolwetse bo seke ba gola ke. So I enjoy go bona bana ba thabile ba phidile ga botse, and yeah, I enjoyed it. Ke rata go fa back, like giving back to the community, because mo re tsamayang gona ke di rural areas and a gona di clinics tse ngata, and then ke go fa back to community e re tswetseng.
Futhi ngifuna abantwana amehlo, abaninkinga amehlo, abangaboni kahle amehlo, futhi siyabacheka. Ngoba uthola ukuthi esikhathini esiningi umntwana uhlakaniphile esikoleni yakhona ukuphefuma kahle uthola ukuthi akaboni uma uthisha abhala phambili yabona so siyabenzela ibuko after siba-checkile ngoba uthola futhi ukuthi esikhathini esiningi mhlawumbe abanenkinga yamehlo ukuthi amehlo mhlawumbe ayanwaya or izinto enjalo then siyaba nawo umuthi labhasini sibabhalele umuthi sibanike mabanenkinga edinga ukuthi banike umuthi ukuze ukuthi babone kahle then kwesinye isikhathi-ke masithola ukuthi uma mhlawumbe sibahlola sithola ukuthi maybe lokhu sokufuna mhlawumbe maybe usizo olungaphezulu kwethu then siyambhalela umntwana i-referral aye mhlawumbe kubona i-ophthalmologist uma bese kudinga ukuthi maybe mhlawumbe bamenze i-surgery or izinto enjalo. Ngithanda ukuthi ngiyakhona ukuthi ngiye la emaphandleni kakhulu ngoba siya endaweni lapho khona uthola ukuthi abantwana abakaze bake bambona udokotela wamehlo, abakaze bake bahlola amehlo. Uthola ukuthi umntwana ube nale nkinga for isikhathi eside, yabona, uthola ukuthi maybe nasesikoleni sosalele emuva. So ngiyakhona ukuthi ngifinyele kulabantwana abadinga kakhulu usizo laba semaphandleni emakhaya kakhulu. Kungijabulisa kakhulu emoyeni yami ngoba ngiyabona ukuthi nami at least ngenze something, ngenze i-difference empilweni yomunye umuntu, sengikhona ukumsiza ngoba sometimes mhlawumbe noma sibuyela kwesinye isikole uyasho uthisha ukuthi lo mntwana siyaperforma, siyaphasa kahle, uyabona ukuthi inkinga lo mntwana beyila emehlweni, beyakade angaboni kahle, yabona. So ngijabula kakhulu nami ukuthi at least ngiyayenza i-difference, nami iphathi yami ngiyayenza ukusiza abanye abantu.
I love what I do basically because traveling is there, getting to see kids being happy when they receive their spectacles. Some have never seen an optometrist before, some that never seen a dental therapist or a hygienist before. So that's the love I get when I meet these guys. I think this is a good initiative, and to me, honestly, I think we need more of this. Four is very little. We have got 4 buses. So it's very little. If they could be, we double the amount and then we get more people to this project, and a lot of people then in rural areas, in very like outside areas, will be able to get the services. So I'd like to appreciate Eskom for giving us this opportunity to render this kind of service to the people.
Important kakhulu because abantwana abaningi la bahlala nogogo bafika bagula kwesinye isikhathi singazi ukuthi sobenzani. Kwesinye isikhathi umntwana alimale khona la esikolweni siyamthatha siyomsa eklinikhi, but makufika lama mobile clinic asiza kakhulu ngoba aba-check everything bese then abhala ama-referral letters sebasise sakhona ukubahambisa kule ndawo kufanele baye kuzona. Mhlawumbe amazinyo simshonise kudoktor wamazinyo, amehlo njalo njalo, asiza kakhulu ama-mobile clinic. Eskom ayasiza ke lamabhasi akhe ahambela zonke indawo, usiza kakhulu. Siyabonga ka-Eskom.
With the Eskom Mobile Health Clinic program, the buses have specifically been designed to provide mobile health services to learners at rural areas where Eskom operates. The 4 health buses are in the provinces of Mpumalanga, Limpopo, and KwaZulu-Natal. The purpose is to curb the medical challenges that children are often faced with during their schooling years. This specific prototype was designed by the foundation, and it encompasses a dental booth equipped with all necessary material to screen, polish, extract, and do fillings on teeth. Primary healthcare consultation room to carry out general health checkups, nutritional assessments, hearing assessments, gross and fine motor assessments, immunization booth, as well as a visual care booth to assess their eyesight, provide the necessary treatment, and even spectacles where necessary. The mobile units have dedicated and competent staff that include a professional nurse, optometrist, and dentist to perform screenings and examinations. Each child receives 20 minutes of quality-focused healthcare examination. Learners with severe medical problems that cannot be treated within the mobile units are referred by the medical staff to the nearest clinics and public hospitals. This project is done in partnership with the Departments of Health and Basic Education in those provinces. The conservative estimate is that each bus will see 14,000 learners per year. Today's episode has shown that Eskom is committed to helping the citizens of this country with initiatives such as the mobile health clinics. This helps restore the dignity of rural children and make sure that future generations are taken care of. Well, I'm certain that you, as a viewer at home, you have learned as much as I've learned about the work that's being done by Eskom in trying to promote the development of our people. Remember, good health is a human right, and taking care of children is a fundamental responsibility. And therefore, credit to Eskom for such wonderful work. Thank you once again for having joined us on this week's Eskom's Journey, and we invite you to join us again next time. Goodbye.